All right, so we're going to work on hip extension in a modified Thomas test position. Okay, and I'll also just kind of show some various things that you can work on in this position because it's kind of a cool place to do a lot. So in order to appropriately get your client in the right position, they almost have to be sitting at the end of the table. Come off of there. Sitting kind of at the end of the table, like mid-sacrum on the very end there, okay? Because ultimately when we bend their hips up, we want their pelvis, we want their legs to not run into the table at all. So the pelvis needs to either be like slightly off the end like it is right now, or like just like right perfectly even with the end. All right. So now her legs are up, and I will block one leg as long as it's not pinching on the front of her hip. You might want to ask that. I'll block one leg with the side of my pelvis here. And I am interested in working on the other leg. Okay, so as I drop down, you probably learned this test on some level in school, just the modified Thomas test, just to see if there's a hip extension limitation, right? So as I bring her down with her knee relatively flexed, what I feel is her knee wants to start to extend about the same time as I run out of hip motion, right? So what does that tell me? Maybe like rectus is restricted on some level, but also may have some like actual hip restriction on some level as well, okay? So, but the very first thing is that rectus. So I know that I don't necessarily just want to work on hip extension, right? I want to work on a combined knee flexion with hip extension so that I can then elongate rectus as well. So in order to do that, I need a way to block the knee, right? So in order to block the knee, I'll come in and just make sure that I can get her foot hooked onto my leg here. And I will start with a little bit of hip flexion, knees blocked, and then as I take her into hip extension, I will bend the knee as the hip goes into extension there, okay? And so now what I'm doing is I'm feeling for where do I feel the first bit of tension, all right? And I'm actually using this hand to help me not fall. I'm like using her for stability because I'm leaning into her leg. I'm holding on to her. I'm actually approximating my hand through her femur a little bit so that she feels a little bit more stable as well. Okay, so hopefully that feels comfortable for you. All right, so now as it goes down, I'm feeling, okay, where do I feel that? Do I want to go not just knee flexion, but with the hip, I want to wind the hip up as well. So do I go into a little bit of abduction or a little bit of adduction, right? And it's just slight abduction, then it gets a little tighter. I have the kind of knee flex to where I want it to be flexed. And now I just kind of want to feel, do I want to just work soft tissue mobilization on rectus, right there, right? And so I could have her purely just try to kick her knee out straight and see if that kicks into my fingers. And it does a little bit, and let it go. But I want to see, okay, actually, I want to get her a little bit further into that range. Is that okay there? And now I want to see, and I could be here, but I have my balance down pretty good now. So I'm going to use both hands to work on rectus right there. Yep, and now try to straighten your knee out. Good, and let it go. I could take this treatment hand, was originally the only treatment hand. Now I can have my left hand as my treatment hand. And now I could resist knee extension and hip flexion. So go ahead and do both of those. And that really kicks it in better. And let it go. I could see, can I take up the slack there? And I can. Now I'm getting more into like TFLE area, and then do the same thing, kick out straight, raise your knee up towards the ceiling, march, yep, and let it go, okay? So it's a great position where you can work on all the anterior soft tissues. Go again, I'm getting into some decent range now. I can work on all the different anterior soft tissues. I can work on hip extension, hip add or abduction, combined with what I didn't say is I can actually control external rotation or internal rotation with my leg as well, okay? So it's just a great way to three-dimensionally wind up with a bias into hip extension. Work on the soft tissues as you go, because oftentimes there are things to work on there, but inherently with the muscle energy technique, you're working on soft tissues and joint as well. So modified Thomas test for hip extension.